Ever found yourself pondering on the process of a white blood cell, or WBC, manual count using a hemocytometer? Well, you're in for a treat. Today, we're unraveling the mystery behind this medical procedure. Firstly, you might ask, why is this important? Well, counting WBCs is a crucial part of diagnosing and monitoring diseases. The process involves diluting whole blood collected in EDTA according to the type of cell count obtained, then counting the cells in a chamber. The count is then multiplied by the dilution factor and reported as the number of cells per microliter of whole blood. The materials needed for this procedure are a hemocytometer with a Neubauer grid, a cover glass, diluents, and a microscope. The cover slip or glass slip is placed on the top of the grid area in the chamber using an airtight technique. The blood sample is diluted at a ratio of 1 to 20 for a WBC count and then loaded into the loading area in the chamber. The cells are counted in the 4 large squares dedicated for WBCs. The hemocytometer contains 2 Neubauer counting chambers, each containing 4 WBC counting squares, each with 16 smaller squares. It's important to note that 100 red blood cells or RBCs equal 10 platelets, which equals 1 WBC. The cells are counted on 90-degree lines for maximum accuracy. Here's a little more detail on the dilution process. The diluents used are acetic acid or distilled water. The purpose of this is to dilute the amount of WBCs and RBCs to a countable level, as well as to lyse or break apart the RBCs and platelets. Timing is critical here as the diluents also lyse the WBCs but take a longer time. Finally, the calculation. The number of cells per microliter equals the number of cells in one large square multiplied by the dilution factor, all divided by the volume factor, which is 0.1. The dilution factor is the reciprocal of the dilution, which in this case is 20. The volume factor is calculated by multiplying the width, length, and height, which equals 0.1. In summary, the process of manually counting WBCs using a hemocytometer involves the careful dilution of a blood sample, the precise counting of cells in a chamber, and some simple multiplication and division. This process, while intricate, is a fundamental part of medical diagnostics and monitoring. So the next time you hear about a WBC count, you'll know exactly what's going on behind the scenes.